Good afternoon, everybody. This is Mike Graham, Senior Vice President of Government Affairs for the American Dental Association. I'm going to speak slowly because I know a lot of folks are coming into the program. Very excited about being able to present this opportunity for you, in large part, because we weren't sure there was going to be an additional COVID relief package at the end of last year. And this is a terrific opportunity for our dentists to learn about what's in that package and get what you need moving forward. I know I've heard from so many dentists across the country that they made it out of 2020 safely and their practices intact, and that's terrific news. But I know that maybe some of you could use a little bit more help, and that's what we hope to be able to give you today. Some insights as to what's in that COVID relief package, some of the labor issues that then surround that, and also that surround the vaccines, because I think many of you need to know about that as well. So let me start off by introducing and letting Megan Mortimer, one of my lobbyists on Capitol Hill, who handles our issues related to the PPP loans and the EIDL loans. And she needs a big round of applause, folks, because she has done an outstanding job. She and my entire lobbying team in Washington are staying on top of this. So Megan, why don't you begin?
Thanks, Mike. And couldn't have done it without your support, of course. You were more than helpful in all of this. So why don't we go ahead and advance the slide, Sarah Lynn? So I just want to get right into it and tell you, some top level things that happened as a result of the most recent COVID relief package that are beneficial to dentists and anyone who took out PPP loans. So first and foremost, we have gotten an additional $284 billion for PPP loans. That's both for second draw loans and for new loans. And also for anyone who took out an original loan and feel that they didn't receive all they should have, return some of the money and want to get it all of that is included in the $284 billion that's allocated for this program. SBA has assured us that they did their own calculations and it's not like the money's going to run out, in 3 days. They think that they have plenty of funds for the people who are able to access a second draw or who were not eligible to access a first draw and are now eligible per the new rules. So for second draw PPP loans, you need to have shown a 25% decline in revenue for any quarter of 2020 compared to 2019. I also want to let you know that we have clarified that any expenses paid for with PPP loans are still tax deductible per the intent of Congress, even though IRS made a false decision in the summertime not to allow that. We are now allowing that, so you don't have to worry. You can deduct expenses you paid for with PPP loans. And then they also expanded the eligibility of certain operating expenses beyond just rent, utilities, mortgage, etc. So now you can use PPP money for PPE, software, cloud computing, property damage related to looting or rioting in 2020, and supplier costs. Next slide, please. And I also wanted to focus on the small business loan changes specifically. One of the things that we've been hearing from our members in the last couple of months was some concern that they weren't aware or did not remember that any EIDL grant money that they received would be reduced for their allowable forgiveness. We hopped on that as soon as we heard those concerns for our members and joined with other stakeholders. And so they reversed that decision. So now when you apply for PPP forgiveness, you no longer have to deduct your EIDL grant amount from your allowable forgiveness. And for those that have already filed for forgiveness, there is a venue and a way for you to go back through your lender and get that EIDL grant money back. And there is guidance out there that I'll direct you to later on in the presentation. Also 501c6 organizations, so our state and local dental societies, as well as specialty organizations, will now be able to apply for PPP loans as long as they don't spend more than 15% of their receipts on lobbying. Forgiveness for PPP loans is now much easier if it's $150,000 or less. Per the statute, it's only allowed to be one page, and it's essentially going to be an attestation saying that you needed this money and that you followed the rules. You will also need to keep some forms and things, and I'll get into that later as well. EIDL grants and loans, there's going to be another swath of EIDL grants. I'll get into that later, and more money for EIDL loans. And also, very importantly, PPP borrowers can now take advantage of the employee retention tax credit, which I will get into later on. Next slide, please. So just a 101 review, I'm going to go through this rather quickly since you probably have already seen this if you've already been a borrower, but for both, original loans, new draw loans, and second draw loans, you still have to follow the basics. You still have to spend 60% on payroll costs, and all of those definitions of what payroll costs are listed there. And then 40% can be used for operating expenses. And as we knew before, rent, utilities, and mortgage, but now it's expanded to these 4 other new categories as listed here. Next slide. The full-time equivalent restrictions still put in place, but as we've directed many of our members, if the members can show that there was a significant decline in revenue over a period of time, they don't have to necessarily meet these full-time equivalent restrictions. So you can take a look at these, but honestly, a lot of our members, here are able to follow the restriction requirements by, following these 3 bullets: inability to rehire the same employees, qualified employees, and inability to return to the same level of business activity that your practice was operating at before February 15, 2020. So most of our members who took out PPP loans qualify for these ones. Next slide. Also, just a reminder, if you offer an employee to come back and they don't because they were receiving more in unemployment or they decided not to come back to the office, you are not penalized for that. Just make sure that you keep documentation that you offered that employment to the employee and they rejected it. And also, if you can, please inform your state unemployment insurance office that you did provide the employee with an offer of employment and they rejected it. Next slide. So what documents do you need? So since the forgiveness is so much easier, both for existing PPP borrowers, new borrowers, and second draw loans, you have a lot less documentation that you need to submit to the lender, but you do need to hold on to some things. Per the law, after you sign this 1-page attestation saying you needed this money and you use it according to the rules under penalty of law, you will need to hold on to your payroll documents for about 3 years and your anything that you paid for with operating expenses for about 4 years, just in case they come back and decide to look into how you spent the loans and if you spent it correctly. And also that you didn't hire all your employees back on one day, and at the end of your covered period, you just fired them all the next. There will be ups and downs in employment per whatever economic uncertainty happens, etc. But this is just a way for them, just in case they have to come back and kind of investigate anything, that you have the paperwork handy to be able to hand it over to them. We also recommend keeping a spreadsheet of how the loan funds were used so that you can just hand that over as well. And like I said, copies of payroll, copies of operating expenses, and then of course you want to keep all of your loan documents. I recommend keeping your EIDL loan documents if you got an EIDL loan for the 35-year maturity or for whenever you pay it off and then an extra few years after that. And for PPP loan documents, I would keep them for about 5 to 10 years, just in case something arises and you need that documentation going forward. Next slide, please. Okay, so I'm going to get a little bit into the employee retention tax credit, but I do want to caveat this section with, if you want to take advantage of PPP loans and the employee retention tax credit, you need to consult with your financial advisor or accountant because it's a complicated dance between these 2 programs in order for you to get the biggest bang for your buck. You can do some basics and calculations on your own if you decide to, but your accountant can really help you navigate forgiveness documents for PPP, allocating certain funds for payroll versus operating expenses, be able to fully take advantage of the ERTC as written. We are also still awaiting additional instructions and guidance from IRS, so your accountants are waiting on those too. So be a little patient with them as they kind of navigate and set up spreadsheets for you to be able to take advantage of both. I know the Academy of Dental CPAs has already put together spreadsheets for their dental practices, and I imagine other accounting firms will do the same. So for PPP borrowers and non-PPP borrowers, the ERTC is if you have a 50% reduction in revenue in any quarter of 2020 compared to the same quarters in 2019, or were shut down or slowed operations due to a state or local government official decree. And then for the first 2 quarters of 2021, because they've now expanded ERTC until July 1, 2021, you only have to show a 20% reduction in revenue compared to the same quarters in 2019. The credit is $5,000 per employee that were eligible for any of this tax in 2020. So that's $5,000 per annually for 2020. And then they expanded the ERTC for 2021 for $7,000 per employee per quarter. So the max that you can take for an ERTC credit for each individual employee in 2021 will be $14,000 per employee. Again, I really strongly recommend that you go to your accountant and financial advisor and figure out the best way to take advantage of this credit. Next slide, please. Also, economic injury disaster loans and grants, those are still available. The loans are still available. They've also allocated additional funding. We see the EIDL loan as a kind of last vestige of being able to, pump up your war chest, as you will. If you've gotten a PPP and you've gotten provider relief and you do a second draw PPP loans and you still feel like you'd like to have some sort of buffer in place, EIDL loans are an option. And then the EIDL grant program will reopen on January 17th. The EIDL grants are grants. You can apply for them. They were $1,000 per employee in the first round. Now only those businesses that are in low income areas and experienced a 30% reduction in their revenues will be able to apply for the EIDL grant. However, if you received an EIDL grant and didn't receive up to the max of $10,000 because they were basing it per employee, you can go back and reapply if you are in a low income area and experienced a 30% income reduction to get you up to that $10,000 grant. Next slide. So I know we're probably going to have a lot of questions, and I'm sorry for talking a little bit fast. We just have a lot to go through, but I am going to post in our chat a link to our fact sheet. And our fact sheet goes very in depth into all of these programs and provides background to you. It also has links to lenders that will be able to provide you with these loans. It has links to other kinds of resources from Treasury and what have you. And so I suggest you go there if you do have questions. And we are aware that we may not be able to answer all questions today. And anything that isn't answered by the fact sheet or by me or others today, we will look to endeavor to find a way to be able to answer those questions and post them publicly to that SBA site shortly.
Thank you, Megan. I don't know whether a lot of you know that, but many of the things that we were able to get into this final COVID package, and clearly we worked with a lot of other organizations and coalitions, many coalitions, but a lot of the issues that we pushed for came from these webinars. So these were hugely helpful to us. And maybe we've got to use this platform moving forward to continue to lobby on some of these big issues, because it was so helpful to get these great questions that we've gotten. And yes, I think as Megan alluded to, the webinar will be posted and this information will be available to you. Let me just say that try to use the Q&A instead of the chat room to post your questions. It may be a little bit easier for us to see those. And finally, for those of you who think Megan may be from New York City because she talks so fast, no, she's actually from Southern California, surprisingly. So
again, I'm sorry for talking so fast. I wanted to make sure we get to questions because I feel like that's the meat for us. Like you said, Mike, it's so helpful to get questions from members because that's how we know and what to advocate for in terms of these ones.
So Megan, let me. We've got a few questions that I want to take now, and then I want to give Kathy Albrecht a chance to speak. But we hope to have enough time to come back and address some more questions. But deadlines for applying for the loans. Can you go over that, please?
Yep, March 31st is the deadline for applying for second draw and for those people who are first time eligible for PPP loans.
What about the definition of supplier costs under PPP expenditures?
So supplier costs are whatever you have to pay in order to, from what I understand, and the definitions are still coming out for specifics, but from what I understand for supplier costs, it's essentially any sort of regular delivery that you may get. So, any sort of equipment that you need updated, any sort of gloves or masks or whatever it costs for you in order to have that relationship with the supplier, whatever contract you have with your supplier, you can now include under PPP operating expenses.
Great. I've got another question here. What to do for HHS grants to be forgiven?
So that's the provider relief question. And although we're not going over the provider relief fund in this webinar, I know that we have one probably planned in the next month or so to go over those things. So provider relief funds don't need to be forgiven. They are grants. However, I think the question might be, how do we remove provider relief funds from taxable income? Because that's still the outstanding question we have, Mike, on PRF, and we continue to advocate for. So we will continue to advocate for that. And as the new administration has indicated, and the current Congress has indicated, there's going to be another relief package probably coming forward. And that'll be one of the outstanding tax questions we will be pushing for that relief package.
Another question, when we say a decrease of 25% in any quarter, if we received an SBA loan in that quarter, but our regular revenues decreased by over 25%, can we qualify?
Great question. Yes, it's about 25% of your revenues receipts. PPP funds do not play into your revenues or receipts.
This is another good question. Are the funds for the next round of PPP expected to run out quickly, or do you have any insights to that?
So,
I know what they set aside. What was it? 3 billion.
284 billion
for PPP.
284 billion for PPP. PRF is the one that, our provider relief fund, they allocated an additional 3 billion to. No, SBA does not expect the money to run out incredibly quickly. They did their own calculations based on, 5016.
You do that, and oh, go ahead, Megan. You were frozen
Sorry.
for a minute there.
I'm sorry. Sorry, I'll go back. No, they don't expect the money to run out anytime soon. They allocated enough funds based on their own calculations, the 501c6s that are now eligible to apply, people who will be eligible for second draw loans, et cetera. They feel that they've allocated enough loans to be able to cover all of those small businesses. That's not to say I don't think you should wait till March 15th to apply, but I don't think you need to rush to your lender tomorrow, which is when small lenders are able to start accepting applications, or even next Tuesday when larger lenders are able to start accepting applications. You don't need to rush for it. So yeah.
Good. How do we calculate average monthly payroll for the second PPP loan based on which months?
It's the same. So you're going to either take 2019 or 2020. You are going to, take the payroll for the annual 2019 or 2020, your whole payroll for the whole year, divide it by 12 so that you get average monthly payroll for 12 per month. And then what you will receive is 2.5 times that amount. So annual payroll divided by 12. So you get 1 month average. 2.5 times is what your PPP loan amount will be.
All right. What if my current lender is not accepting applications for first or second draw PPP loans? What do you recommend?
Well, we have a link in our fact sheet to lenders who are accepting applications, and it's so easy to follow. You can type in your address and they will show you in your area the lenders that will accept your applications. There's also non-traditional lenders out there. PayPal became a lender for PPP. I think Venmo is looking into it. So you don't have to go to your current lender. Go to a different lender, or go and use our fact sheet to find a lender in your area that will provide you with that.
So someone had a follow-up question to that, I think. You don't have to then apply with your original lender for your second round of PPP. Good.
You absolutely do not.
Right. Let's see. How does one define low income area?
That's also a link in the fact sheet that I will provide a link to. There is a search engine that is provided by the federal government to be able to determine whether or not your area is considered a low income area. So again, I'm going to be putting a link to the fact sheet in the chat shortly, and you can go there, and it's one of the links that's included in that fact sheet.
We determine when you have to apply for the loan, but is there a time frame in which the second funds have to be used?
Great question. It's the exact same rules as the first draw. So you have between 8 and 24 weeks. You can do it in 10 weeks. You can do it in 10 and a half weeks to spend your money. You get to choose 8 to 24 weeks. You have to spend it by that point. And then again, by the end of your covered period, whatever period of time you choose to spend that 2.5 worth of payroll and PPP funds, you have then 10 months after that covered period to apply for forgiveness.
Terrific. I tell you what, I'm going to hit the pause button on Megan right now. Thank you so much. And Kathy Albrecht, why don't you go? And then if we have time, we'll take some questions, some more questions for Megan after Kathy speaks. Thank you, Kathy.
Perfect. Thank you, Mike. There were a couple other developments with respect to employment issues that came through with the relief bill. And part of it is the Family First Coronavirus Act leave requirements expired on December 31st, 2020. So folks have been asking, do I need to extend FFCRA leave past December 31st, 2020, even if it hasn't been exhausted by the individual? The answer is no, you don't. But you can, according to Section 286 of the relief bill, practice owners may choose voluntarily to continue to provide leave through March 31st of 2021 in exchange for a payroll tax credit. So through the first quarter of 2021, practices may choose to do it voluntarily. The same rules still apply. Can we go to the next slide, please? The same rules still apply. In other words, if they've already exhausted their emergency, the 80 hours of emergency paid sick leave, and the up to 12 weeks of paid emergency family and medical leave, 2021 did not restart the clock on that. So in other words, the availability for practices to choose to take the tax credit really only applies to those who still have who have either new claims or have or have some time left to expire. The one thing to keep in mind is for those who start their leave after January 1st of this year, while they may be covered, or you may choose to have them covered, those folks do not, and this is sort of part of the situation we're left in because of the way this was passed, there's no right to reinstatement after this period for those who just qualified after January 1st. So it's a little confusing. We will be, we're in the process actually of revising our current leave provisions to provide this, but for just so you know, those should be available by early next week. But if you choose to do it, you can, in exchange for a tax credit, generally speaking. If you choose not to do it, you don't have to. The other thing you want to think about with respect to those who have exhausted their paid leave under these COVID provisions, don't forget that states and localities, particularly localities in California, there's a couple of them, that will say, you know, you still have other requirements. And in other words, if you exhaust the federal leave and state leave is still available, you still do have to, you know, comply with state and local laws. The other thing is, well, I think actually that's, the other thing is office policy. If you have an office sick leave policy, or maybe you have a practice that's so large that family medical leave also applies, you still have to consider those things. So as I say, we will be updating the FAQs, but this is really just a heads up. Next slide, please. The other thing that the relief bill did was extended some aspects of the CARES Act regarding unemployment compensation. It's a little complicated, but there's a couple of things to know. The relief bill extended the pandemic unemployment assistance program to continue to provide benefits to individuals not eligible for unemployment compensation. And that includes both employed and self-employed through March 14th of 2021. There's a limited phase out for some through April 5th, 2021. What that means is that if you are eligible for continuing benefits, you can't apply after March 14th to be eligible first for the starting March 15th. But if you are already entitled to benefits and you continue to receive them, you will continue, the staff member would be continued to receive them through April 5th. It also extends the reach of the Pandemic Unemployment Insurance Act, Assistance Act, from from 39 to 50 weeks of total qualification. Next slide, please. In general, another aspect of the unemployment changes were that it does provide an additional $300 in unemployment compensation through March 14th of 2021. So basically, although the $600 credit had expired in, I want to say June or July, starting with the week after December 26th of 2020, folks will be, again, folks who are entitled to unemployment compensation relief through these programs will get another $300 per week through that program. So another part of this is that it does extend the aspect of the Pandemic Emergency Unemployment Compensation Act benefit to people, and this is meant to cover people who've already exhausted their regular benefits. This provided extended benefits for further periods of unemployment, and this extends that extension period from 13 to 24 weeks. And again, this extends through no new applications for the coverage after March 14th of 2021. But if you're already receiving it and entitled to receive it, you will be still receiving it through April 5th of 2021. There's also another thing I haven't mentioned here. It's sort of maybe a niche area, but for those folks who receive a mix of W-2 income and 1099 income, if the folks have received $5,000 in self-employment income, they will be entitled to an additional $100 under the sort of extended unemployment compensation. It's akin to the $300 addition to those who are sort of mixed workers, if you will. Let's see. Now, with respect to the state, to the mixed workers, mixed earners provisions, those the states have the right to choose whether they want to give that or not. In addition, with respect to unemployment compensation, any individual who requests unemployment benefits for the first time in this context after January 31st of 2021 will have to provide significant documentation with respect to their prior employment history, and I think within 21 days. I think this is meant to address potential fraud in making claims. Perhaps some of those cows are out of the barn, but regardless, that's another new requirement or another new wrinkle in the new COVID Relief Act. Another set of questions that we've been getting lately a lot, and if we can go to the next slide, please, is, and this frankly, ever since the Pfizer virus was first, or vaccine was first approved, we started receiving these questions. And the questions are basically, can I require in my practice my staff to receive a vaccine? We do have frequently asked questions on this already posted, and they're sort of one set from the employer standpoint and one from the employed dentist standpoint. And I will, after, as we move on with the program, I will include a link to those in the chat so folks will have them. So, can a practice require staff to receive a vaccine? Sure. Yes, as a sort of preliminary answer to that. Yes, but if you have a practice of more than 15 employees over the course of a year, so some of the larger practices, you will be subject to the anti-discrimination laws with regard to disability and religious accommodation, as well as pregnancy-related sort of emergency situations, which might require accommodation. So you may require a vaccine, but if you have this size of a practice, if someone comes in and has a medical excuse for why a vaccine would be dangerous for them, you need as a practice to consider whether an accommodation would be possible. So for example, if a staff member said, well, before the vaccines were available, it was perfectly fine for me to wear a mask and goggles and a face shield and use gloves and keep social distance. Why can't I keep continuing with that now, given my own personal situation? So this is a question that might come up in the larger practices, because the question is really going to revolve around, really, is it enough to do what we've been doing? And if it is enough to do what we've been doing, do you really need the vaccine? You may need to make a case for why, if you want to deny it an accommodation to someone who either through their disabling condition or some more catastrophic condition relating to pregnancy, or religious accommodation. My religious beliefs don't permit me to receive vaccines, for example. Those would need to be considered by larger practices. Now, the state itself, and this is also in flux somewhat, the state may require vaccines of some healthcare providers. That's really still up in the air right now, but in any event, it may not be all office staff that would be included in any sort of requirement that, for example, staff with patient contact need to receive a vaccine. That may not cover office staff, so you may need to look at other alternatives. Now, if you don't permit staff to opt out of a vaccine requirement, you may be required to pay the costs of administration of the vaccine, at least. Now, the cost of the vaccine may be free, but to have someone administer the vaccine, there may be costs associated with that. That might not be covered by health insurance. Also, if you're requiring staff to take off-duty time to receive the vaccine, you may need to pay for time off. Now, another question that comes up is, what if I require my staff to get vaccines and they become really sick? That would be a situation, typically, unless you could prove that it was not an illness attributable to the vaccine, it would be considered a workers' comp injury, which would limit damages in some respects, just like any other, say, slip and fall in the break room. Employee versus independent contractor is different. You can require an independent contractor to get a vaccine, and true independent contractors aren't subject to these sort of larger employee and other legal sort of requirements. So we move to the next slide, please. So you need to consider some of these legal issues, but honestly, and maybe at this point, maybe more practical when we're asking this question. You may require it all you want, but if you can't get it, it's really going to be hard to require it of your staff. Maybe some of your staff may be able to get vaccines in the state in which you practice. Maybe staff members might not. And there is a fair amount of social wariness in the population about potential side effects of the vaccine, and frankly, personal beliefs about the efficacy or scientific support for the vaccine, or whatever the personal beliefs may be. Those that don't rise to the level of a religious belief or a disability accommodation, you don't have to give it, but how are you going to retain, what if half your staff doesn't want to receive the vaccine? How do you preserve your office and your office staff in that context? So there's a lot of moving parts, or at least considerations to think about, because the simple answer is sure, go ahead. But then the question is, good luck enforcing it, perhaps. So we're working on that. We expect this to be an evolving situation. I think, frankly, if we can move to questions right now, that's pretty much what I have. But again, to remind you that I will be posting those FAQs with respect to vaccine requirements. And by early next week, we should have modified versions of the FAQs on the leave requirements. So Mike, if you have questions, I haven't been monitoring, but.
Thanks, Kathy. We actually have just a couple. with regard to vaccines, and they both relate to small dental offices, and maybe we can just clarify here. And the question is it advisable to mandate a COVID vaccination policy in a small dental office?
It honestly, I would say it depends on the availability of the vaccine and requirement of the vaccine in your area. Those would apply to small as well as larger businesses. But I really do think, the ADA has been working separately on trying to address the vaccine reticence issue. Anecdotally, we're talking about, our dental hygienists within childbearing ages reticent to receive the vaccine because of concerns. We're talking about ways to bring in OBGYN folks to see what we can do to allay fears. But your biggest impediment may really be sort of the social cost of requiring a vaccine in a practice where people don't want to get it. And that may depend on whether you're in a large city or a small rural area. It may depend on any number of factors, but I expect there would be regional differences in the pushback you may get from your staff, and it may be penny wise and pound foolish if all your staff quit. So, yeah.
And somewhat related to that is, what if staff rejects taking the vaccine? Are you mandated to pay them?
No, you have to consider whether to make a reasonable accommodation. If it's a condition, for example, let's say it's a pregnancy related condition, or it's just like, I really don't feel comfortable because I'm pregnant, but a doctor doesn't say anything that requiring me to be, off work entirely. I mean, you could furlough the employee until after the pregnancy. That would be voluntary. And that would end up being an unemployment compensation situation. The only thing I would say about, could you terminate? Yes, so long as you haven't committed any legal violation, so long as state law doesn't require you to keep them on. But yes, you can terminate, but do you really want to terminate someone who might be valuable to your practice? So I don't know if there's a better way to answer that, but I'm happy to take that offline if the individual has further questions.
Okay. This is actually a question for Megan. Maybe a couple other vaccination questions will come in, but Megan, the question is, can you apply for a PPP second round loan if you have not completed the forgiveness process for the first loan?
Absolutely. You don't have to wait to apply for forgiveness to apply for the second round. You just have to essentially say to your lender, yes, I've allocated the first PPP money already to payroll and expenses, and now I want some more.
Okay, this one is a little bit complicated, so I'll speak slowly so that even I can understand it. Can you still qualify for a PPP round 2 loan if you've had a 25% reduction in receipts for Q2, but have since then for Q3 and 4 have been back to normal production? Does that make sense?
Yep, it's 25% reduction in receipts for any quarter. So if you did okay in 3 and 4, but you didn't do so well in second, that counts.
Okay. Will the total amount of both PPP loans, right, round 1 and round 2, be added together to determine if you can use the, use the $150,000 simpler forgiveness form?
No, sir. Each loan will be treated differently.
Okay. So if you took out 100 in the first and 100 in the second, you can use terrific.
Yeah, because
okay?
I mean, you can do it with different lenders. You can do it. So it would have to be a separate application process altogether.
Great. All right. One more. Are EIDL and IRS stimulus, are the EIDL loan and the stimulus payment taxable?
Neither are taxable income.
Okay. Should they be considered in gross receipts? And the answer then would be no. Great. All right. Let me see here. Because I think
And I did answer, I just want to let everybody know I did answer handwritten some of the questions. So please go into the answered section of Q&A and see if I've answered your question there.
Oh, good. Hey, let me go back, Kathy Albrecht.
Okay,
I got one for you here. If an employee refuses the vaccine, can we get them to sign a document saying they are aware of, I guess, the offer to get the vaccine, but are refusing it? And if yes, I guess if yes, meaning they sign the document, is there a template? Do we have a template document for that?
we don't. I mean, and the reason for that is this. You could always document that you advise someone that you want them to take a vaccine, and you can document it. But the question I would have is, for what purpose would you document it? If the purpose is to say, if you get sick on the job, I won't be liable for workers' comp if you catch the virus at work, you would not, that would not be a defense for you, because workers' comp, you can't ask for release of workers' comp benefits if the if the infection was sustained in the workplace. That is the short answer to that.
Yeah. Let me just update those listening to this webinar on what we've been actually doing at the ADA with regard to vaccines and how we've engaged in that. I'll just take 30 seconds to do that, I hope. It breaks into three different areas. One is, how do we make sure that dentistry is in the first tier of getting the vaccine? So you as dentists or your dental team members are in tier one. We lobbied CDC very hard for this, and I think we enjoy a very good relationship with our colleagues and friends at CDC, and they put us in the top category, 1A, to get the vaccine. Now, CDC can only give recommendations to the states. It was left to the states to make the decision about who would get the vaccine. I'm happy to report that I think most states have put dentists in the 1A category with the first tier, so that you should get that. It's unfortunate if dentists were put in 1B or some other category, but CDC did recommend that. The second thing is allowing dentists to be able to vaccinate. And we've been lobbying for that as well. And again, that's a state by state decision, but I think some states are working hard to give you that option, to give the dentist the option to be able to vaccinate. And then finally, the third category is educating dentists, educating dental team members that they should get the vaccine. And then how do you educate your patients as well? So that's, we sort of took that tack to try to get on the whole vaccine issue. Now, I got another question here for Megan. Is there a form we need to fill out to show provider relief funds were used correctly?
So again, that's provider relief funds. It's the HHS stuff. The portal is opening up tomorrow on HHS. David Lynn is my colleague who's the subject matter expert on this. And we do have a fact sheet for the provider relief fund that I will also put in the chat that may be helpful. But again, the portal is opening up tomorrow for where you need to start reporting. You have until February 15th to report what you need to report to HHS in order to make sure you can hold onto all of your provider relief fund amount.
I'm going to try to squeeze in one more question, Kathy, I think we
Sure.
need to be brief.
Yeah.
And the question is, after most of the office has been vaccinated, if we have a non-vaccinated employee get COVID, do we still have to quarantine the whole office?
Well, this dovetails with another question that I wanted to answer live, and that really gets down to, if you get the vaccine, can you still get or give COVID to another person? And that is something that's included in the fact sheet, and it's very important because the answer to that is yes. All of these vaccines, first of all, getting the first dose of a vaccine doesn't provide the same coverage as the second dose or a complete dose or regimen of the vaccine. Secondly, you may have already had COVID when you got the vaccine. And we don't know yet how long, and there's certain percentage that doesn't provide immunity in. So the question often comes up is, if I get vaccinated, do I still have to wear a mask and socially distance and everything else? And the answer to that is yes, because for those different sort of reasons, it may be incomplete. It may not work for you as a person as a vaccine. Maybe the 5% of the population doesn't work with, and you may have already had COVID, and therefore the vaccine was not as effective in preventing it. It's also, I believe, an open question as to whether someone who has the vaccine can contract it and spread it without themselves receiving. But I'm no expert on that one.
All right, thank you, Kathy. I'm going to check with Sarah here because I think we've used up our time. But Sarah, is that where we are right now?
Correct. We had allotted 45 minutes. We don't have a hard stop. That's up to our presenters. I know that you have a busy schedule. So we do have a number of questions still in the queue. However, like Megan mentioned, any question that's not answered by the fact sheets, we'll be taking a look at those, as well as posting those links to the fact sheets in the chat. I'll also include those in the post-webinar email. So hopefully that'll answer some more questions.
All right. Well, I think we should stop there. We'll try to address those questions, as you said, Sarah Lynn. And I'll let you. Thank you so much to everybody. We had over 600 participants, and I think that's fantastic. We'll continue to be putting out lots of information at the ADA on this, and no doubt we'll be using the questions that you've asked here to help answer a lot of those questions ongoing. So thank you all and have a wonderful day.